Oh. But they don't back down.
I mean, did you see the video of the salt trucks?
How many is that? Salt.
Yeah, so one thing about Chicago.
That was today? Okay.
It was yesterday. Two things about Chicago. One, oh man, are they prepared for ice and snow? And yes, that is a pun they enjoyed making. One, they're very prepared for winter.
Okay. But if you need anything.
Because we don't get snow, we get snow days maybe once every 15 years. Two, Chicago politicians don't fuck around.
Yeah.
And corruption can be an asset.
Was that something they released?
Yeah, they literally just had salt trucks barricading all the highways.
So that they could.
Thanks, Ashley. Oh, I missed that. That was happening today?
Yesterday, I saw it yesterday.
Yesterday.
Oh.
Yeah, I saw the post yesterday.
That's quite amazing.
But yeah,
Out there.
I mean,
Yeah, no.
I really like it. Brandon Johnson was the last person he was the first mayor I ever voted for who won.
Oh, well, yeah, now we're gonna see what happens because, that's a very interesting. I didn't see much of salt.
Yeah, look it up.
I will.
Chicago.
Keeps making me laugh and I was impressed with the history. I hope I make it there again. That's the only time I lived. That was 25 years ago.
June, July, August, September, Chicago is the most
Beautiful.
beautiful city in the world.
Yeah.
Maybe don't visit the other months unless you get lucky. Like that 70-degree day and.
Oh my God, yeah, that was crazy. I think if you look it up, I definitely believe it was 2000. I don't think it was 1999. I think it was 2000. It was like the warmest day in Chicago for whatever reason. Something weird was happening. And I was prepared for like, I was ready. I was not going to be cold. And then I bought all those extra clothes. I was like irritated. So. Oh, no, they're sorry. Better that than to be underdressed.
Oh my God.
Cause then I would have been really upset.
Okay.
Yeah.
All right, everyone, we have a quorum. Wow, do we have a quorum? We usually get a quorum. It's just that, I'm glad that we're on time. So can we call the meeting to order? Now it's 6:36 p.m.
I'm
Okay.
ashamed that we start the meeting.
Seconded.
And we have a lot of new members. And I'll start with introducing, as some of you have already been introduced via email, our new co-chair, Cameron Clark. And Cameron not only is a member of our general board, he just did a stint as a fellow. I think it was a 2-year fellowship, Cameron, with WEAT. And we have we being the community board, have a close relationship with WEAT for environmental justice. So, and he's also a med student. What year are you in now?
No, I'm in my 4th year.
He's going into his 4th year in med school at Columbia Irving Medical. All right, here. So, and he's done so much background work and study on the environment. So, in just so many ways, he's a compliment to us.
Right from Dr. Torp.
Yeah, right, and just like Dr. Torres has all his credentials, he'll be formally introduced when he does his special insight perspective tonight. But so we've been fortunate to have this kind of expertise on our committee. So let's go around the room and I'll just say the names, so I can learn to say them, but each one just introduce yourself and thank you also for our online committee. So we now have just before we get started with other names, we have every other month a conference room, so a little larger. So I'm hoping we can and everyone who joins us online here in person. So thank you so very much for showing up, coming and having your support. And again, just, kind of have it in mind, we'd love to have you in person with us November, but we have a meeting every month. It's just that every other month we'll have a larger room. And John Martin, you're in Health and Environment Committee. So I know you belong next door, but we welcome you.
Yeah, that's all.
So it'll be every other month, we'll have the opportunity to stretch out a little bit more. Than, when we were just in the other office, it was more like a lounge, but here we can do a little bit more. Entertain a little bit more. Okay, so now we can go around, the new members of the committee, you'll see here, I have,
Is it
what was
recorded?
given to me, but
It's recording?
yes, I think
Yes.
it's recorded.
Uh-huh.
Dr. Felipe Castillo this is in error, but that's okay. He likes joining us from time to time. And I don't think Chuckton is on the community. I don't think his name on that larger list, right? But Elizabeth Eastman, I said hi when you came in. You got
My apologies.
I know Elizabeth for a long time, mainly through her mom years ago, and Louise, a top mutual friend of ours. But are you just asking, you in health and environment? You don't have to say. We're next door.
Yeah.
You're right. The same thing happened when we were next door too, so. Okay, so that's Elizabeth, in the front row there. Monique?
I think that my credentials, they need to be fixed in the agenda. Whenever you guys get there.
Yeah, we didn't, I think you were saying we didn't adopt the agenda, is that what you said? Evan?
Oh, no, I was just after calling the order, we have so many new, it's just about everybody's new. So I started out introducing, the members of the committee. I guess I could have done it after the agenda, but we're on our,
He said mine.
and I'm not hearing it, but, so
He
maybe we
typed
turn it, okay.
Mm-hmm.
Mainly because there's just so we can get to know each other a little bit. Monique Carter Cordero is a double pleasure. She's not only a triple pleasure. She's not only a member of our committee, she also chairs or co-chairs the task force on cannabis. Raise your hand, Monique, and everybody may know you. And she's also our second vice chair of the community board.
Actually, first vice chair.
Oh, I'm sorry, I'm still in last year.
I know.
First vice chair of our community board.
Yes.
Okay. And Heather Jason, also double pleasure. Heather is a hard-working woman with the Parks and Landmarks Committee. And she is a member of our committee. So Heather, raise your hand back there. Heather Jason. And then, okay, now this is my actual time saying it out loud. Lena Nefoniashi.
Oh my God, that was so good.
Wow.
No one ever does. Even Lena is really many people. And thank you. Lena is great, so don't ever try to say that. I appreciate
Or
it.
Lena in.
Yeah, perfect.
Okay, welcome.
Thank you.
And then Yanira Ramirez, did I say that correctly? Is Yanira here? She's not here, maybe we'll see if we got a doorbell. So anyway,
Yes.
and then Jordan Scherer, Jordan's back there. Hi, Jordan.
Hi.
Welcome. Okay, I think that's it. So now we know each other, and
Everybody said.
was it. And the one who spoke up so boldly there, Dr. Edwin Torres, is the last co-chair, and he's hard working. You hear his name a lot. And pleasure with all the co-chairs really that we've had this committee, and they come back and visit with us from time to time. But Edwin has technically never left, just in name primarily. And he's been invited to present, so you'll hear from him. And then we have a terrific group of persons who generally tune into us. Generally, we have about 18 to 20 that are online, but again, it would be great to actually have them come in person. We have fewer number this time, but welcome all the same because they've been very, very active and very important to us. Okay, having done all of that, can we, with everybody who's new to everything, get a motion to adopt the agenda?
So moved.
Seconded.
Okay, thank you. All those in favor?
Aye.
Okay. Now, and actually, I got bogged down, so I don't have our AI and adopted minutes from, June. So I'm requesting that you not mind if we table that till, the October meeting. And then I am so happy, that Cameron, he wanted to kind of like, see how everything flows, but he's old hand in conducting meetings, but he's chill. Gonna have him chill a little bit since he's also a student, but he's gonna help us out with minutes tonight so we can blend what's actual with the notes he takes with AI. And sometimes the AI, I don't want to totally lean on it, even though it can be good, but maybe the information may not always be worded as accurately. That's what people are finding out. So anyhow, and I saw it myself, so.
Is it on though?
Yeah, I believe that she does have it on. Do you see it?
I mean, I can't tell from behind.
It looks like it says recording on top,
It's
but that's not the
recording
same
for
thing,
sure.
right?
And it generally records to the cloud. So
Right.
the
So that's not the
AI.
AI,
It is.
Right, AI is different from
Yeah.
recording,
It
I
is.
believe, right?
There you go.
the AI.
Thank you.
Okay, great.
Okay, and so we appreciate Ashley setting us up. Ashley was the young lady who came through, who was our community associate. And there are two of them, and I'm not sure if they are gonna alternate nights or they have certain committees they're assigned to or nights. We'll soon find out, okay? All right, just briefly with a couple of announcements. I see Chris, Chris is online. Chris Johnson? Chris? Here's that. But during, their Emma Bowen Community Service Centers.
I'm here.
Oh, great, Chris. Well, I just wanted you to tag along here, and be very prominent with this Emma Bowen Community Service Center piece. The Emma Bowen Community Services I would say over 40 years old and in existence in this community. They are definitely a community partner. They were formerly at 1727 Amsterdam, which is 145th Street.
Still there.
Okay, still there.
Still there.
As in the area of mental health for all of these years, providing services to children. And to young adults and adults. And they have begun, and it should almost be completed, the new building on 135th Street. We got letters of support. They got their own letters of support, but they have a dynamic leader in Pat Jordan, who's chairman of their board, and just an outstanding number of staffers who not only work to get approval for the location, but we did a tour and it's really wonderful. I know there was a little snag in the summer and I'm hoping it worked out. Can you update us, Chris?
Sure. So everything appears to be in motion for the center to officially move sometime beginning next month. The issue that that came up with Oasis was resolved. The center received a waiver. So all of their programs and services will be moving to 135th Street. They're now just waiting for the final approvals from city buildings. They have a fire inspection coming up, and so once those are done, the move will take place. They should be in the new facility sometime in October.
You know, it might be nice, that sounds great, because we were, very, very concerned. And, I think Oasis is a wonderful organization, trying to do the best that it can in funding. And if that funding has gone to a reputable, well-intended group in the Bowen Community Center. So maybe there's one of our meetings we might be able to hold there. I saw the space. And we had an invitation at one point to come. So if everything works out, maybe October or December, this committee could, come by and visit.
Oh, absolutely. There'll be an open house once the facility is finally open, sometime hopefully in November. And of course, we want everyone from the community board to be there. I would be remiss, however, if I did not take a moment to thank Mr. Edwards, who was pretty much my summer buddy. I don't know if he's there tonight.
He's not here right now.
Okay. He and I were on the phone pretty much all summer.
Trying
He
to
was
work through.
he was very helpful in terms of the Oasis situation, and he was also helpful in terms of getting us to host the community health fair, which is coming up on September 27th and is going to be at Riverbank State Park. And I'm going to put
And
the
I
flyer.
know he was very concerned and calling to get support from all the necessary people and some ideas to make sure that everything remained intact. And so we on our committee appreciate him very much for those efforts as well. And I know, Chris, you're always working hard and setting things up well as well. So thank you for that. And he'll hear your remarks and hear it from us as well.
Okay, thank you. And I also want to thank you, Laquita, and the committee. Like you said, you guys put together a terrific letter that was really, I would say, the spearhead in terms of us getting through all of the approvals with both city and state agencies, and it is greatly appreciated.
Thank you. Keep up the good work. And once there, Emma Bowen will be at that location for about 5 years, 4 or 5 years.
Yeah, 4 or 5 years.
And then they will move back to 1727 Amsterdam. And 1727 Amsterdam, you'll hear a lot of it. It became sort of controversial. We won't get into it tonight. But the ultimate good thing that came out of it is this board's fight to have community input into what was to be built there and how we wanted it to still serve the community and not, to delete or eliminate some of the health organizations that were there. So that was a major effort that came through, and thanks to producer Barry Weinberg, actually. He did the research that indicated that a ULURP was necessary. And the ULURP is, can't recall what all the letters stand for right now, but how land is to be used and community input is asked for, the history is there, and we get to have a say. and what happens there. That's very important. And we're not taking for granted when that happens. Okay, and so you'll hear much more about that at a later date, maybe even next month. Are you arts and?
No,
How'd you
oh
be?
my god, I went to the wrong.
That's all right, you helped it?
Yes. Oh, awesome. I was inspired.
Okay, just one or the other. What's your name?
Janita.
Oh,
Yes.
I called your name out. Welcome, Janera.
Thank you
This
so
is
much.
another new member, not only of the community board, but of this committee. So that's fabulous.
First meeting.
Okay, so next, at every meeting, we like to hear from New York City Department of Health and Mental Health. And one day Pauline will be able to be in person with us as well. She is our liaison. And I put several things. I know you knew about the request from us related to Legionnaire's disease, but I'm adding in COVID-19. Just an aside, 50,000 people died last year from COVID in this country. That, and I don't know what the number is for New York State, but it's still great. Measles, we have an incidence of measles, City College, I believe. I'm not sure if it's just one or if there were more, but just having one, that's like what an anomaly is, just unheard of, except now or last year. And then immunization. So, Pauline, take it away. And if there's need to have someone deal with another, come in, that we can invite, next month, let me know, because those are several big topics, though.
Hi, Laquita. Hi, everyone. Thanks for inviting me to your meeting. I hope everyone had a great summer. So just a general overview of the Legionnaire's investigation for Central Harlem. As everyone knows, it began earlier in July and then it concluded in August. Unfortunately, it was quite a large, we had quite a few patients diagnosed with Legionnaire's disease, and unfortunately, we had a few deaths also. But I think in general, what was beneficial for this particular case was that due to legislation change from the 2015 outbreak in the Bronx, we were able to identify all of the cooling towers rather quickly in the neighborhood, and we were able to issue disinfecting and cleaning orders to them right away as soon as our disease detectives noticed the community cluster was occurring. So I'm happy to answer any questions people may have about the investigation. I know people were very interested about getting building information earlier on in the investigation, and I can talk a little bit about why. One, it was difficult to pin down exactly which cooling tower may or may not have contributed to the cases because you would have to match DNA from the actual patient's samples to a sample from a cooling tower, which took a couple of weeks for samples to grow in a lab. So it typically takes about 2 weeks for samples to grow in the lab. And then follow-up samples, of course, take an additional 2 weeks. And so towards the end of the investigation, we were able to share sort of which cooling towers matched with patient samples, but also it's very difficult to collect patient samples at the moment because for medical professionals, the most important thing at that point in time when someone is coming in with severe illness is to stabilize them and provide them with medication right away. And so once they're provided with that medication, it's more difficult to collect what they call sputum samples, where they have to get that sample directly from the lungs. So also, as part of standard procedure with the health department, when it comes to a community cluster, which is different than a building investigation, we don't typically we typically provide a larger area zip code range because we want people in that entire zip code range to be aware of how they're feeling. We don't want to give like a specific cooling tower, we don't know right away in the beginning, but also we don't want people to feel either they're not affected or they're overly affected, right? Because it doesn't, when it comes to a community cluster, it's not really building specific, it's in the environment. And so people who spend a lot of time within that zip code could be exposed to the Legionella bacteria. And so we don't want to give people any like false, either false comfort or false distress that they might be too close to a cooling tower or, not close enough that they didn't have to worry. We wanted everyone in those zip codes that were affected to really pay attention to how they were feeling. So that's, something I know there were a lot of people who are asking for immediate, addresses right away. And that's really not something that we at the agency felt like would be beneficial for everyone in the neighborhood to really pay attention to how they're feeling. So the messaging really was, if you work or live in those particular zip codes, like everyone in those zip codes should pay attention to how they're feeling. As soon as we knew and were able to identify which cooling towers were the problematic ones, of course, we issued, them to, one of them wasn't even registered, the cooling tower. So of course we made them register their cooling tower, but then also clean and disinfect as well. And I know there's lots of conversation around new legislation, additional legislation to make sure that buildings will now be even more responsible, cleaning their cooling towers more frequently, and having agency staff go out and inspect them as well. So I think the original legislation was made where it was a biannual inspection report because cooling towers are seasonal, right? And that they're not operational all year long. They're typically used for internal air conditioning systems. And so they are typically active in the summertime. But I think, of course, having more restrictions or more recommendations for more cleaning, of course, will always be beneficial. So, those conversations at City Council are ongoing, and hopefully more legislation will be passed to make sure there's more oversight over the cleaning and reporting of cooling towers. But if there are any specific questions, I'm happy to answer them now.
Dr. Flores has his hand up. Edwin?
Yes, thank you, Pauline. I'm going to be a little critical here and just push back. I think that, to try to frame this response of the outbreak as a, sort of, success that more life were not lost. I think that the reality of the crisis, both in the prevention and the mishandling, speak to a different story. The outbreak, as we know, originated in city-run facilities. And let's not forget what happened during that time. This was a very hot summer. People were told to go to some of these facilities so they can be in a place where, heat didn't cause trouble to them. As we know, the heat kills more people than the cold. And these are trusted facilities, the hospital, right, CCNY, and other public sites that the city is running. I think that, we have a glaring failure here of oversight by the city agency, the one that we're tasked with protecting these very residents from this community. And, the weak regulation of requiring the cooling tower testing only 90 days after you have Legionella growth and this goes unchecked, is terrible. It's horrific. We got to be more proactive here. And, by allowing this, from contamination to spread, and to say that people, giving them, information of potential sites that is going to create a false sense of security, the opposite can happen to be true. That also not telling them allows people to be more exposed. I think that even after we saw, the positive test, the remediation sort of lag, while residents were less, we were left uninformed. I was calling Laquita, I was calling Victor, about which building we're possessing risk for the community. We have people here who are compromised. So the communication was very slow. And I think that we have to hold ourselves to a higher standard because life were lost. And, just like we learned from the past outbreaks, I hope that from this one, the same is true, that public health succeeds. And it will mean that we will have better prevention for the community. Harlem deserves better. Each one of those lives that were lost deserve that the community also has a better response. And I think that, we have to be proactive and not reactive with these type of cases because every year we go through the same thing. I digress. Thank you.
No, that's really important. It was, had people in Harlem, across the board very alarmed. Most, even though, most of the buildings were in, say, Community Board 10, there were a couple of buildings in 9, but it really doesn't matter. The Harlem community was exposed, and especially as Edwin says, not, people just not knowing. And no, you can't supposedly catch it if, someone here has it and I happen to go up, shake hands and talk to them. But still, we want our families to be alerted, and particularly as a community board, we have a responsibility to share as much information as we can and should. I know, it got so bad and people were asking so many questions and we weren't getting answers. Our state senator Cordell Clear got very involved and we had a pretty big, Zoom town hall on it. And we want to thank her, Victor, our board chair, and, the boards, let's see, it's 10, 9, 10, and, 11 participated in that. And, we were all on, as many of us that could get on, were involved with that town hall. And there are some of the questions that we're asking in terms of why is it that when it really breaks out and people are dying, as seems to be in neighborhoods predominated by people of color. And I'm not sure we got a really good answer on that, but negligence, it really boils down to negligence because everyone is saying it's totally unnecessary. And we know that there are lawsuits because I know that Reverend Sharpton and Attorney Crump have, I think they did a big announcement a couple of days after Senator Claire's town hall that there was a lawsuit because these are families who had some death, 7 so far. And then 108 or 103 that were hospitalized at one point. I'm not sure how many are out. But that's very, very serious.
Yeah, but now it's spreading to the Bronx. They're finding it in the Bronx now.
Oh, really?
Yeah.
Everyone, this is Monica Dula. Monica was our co-chair several administrations ago. And she's, I'm so happy that she's still active with us as a public member right now.
Yeah.
So, yeah,
So it's appearing in the Bronx. There were several buildings on 149th Street.
So the group.
Yeah. So, apparently those cooling towers are supposed to be cleaned every 3 months. And, in my building, I asked them, they're bad too, they only, clean it once a year, and I spoke to the manager. But they clean it, and then they have someone come in and test it, and then they have to send the test results to the city. So it's just not happening in Harlem, and there's no one making it happen.
Right. Where do we put our pressure? Where do we?
Buildings, it's buildings.
Individual buildings?
Right, but I'm saying the Department of Buildings, we need to be on them to make sure that they get the reports every 3 months. They have to send a report to Department of Buildings. So.
Not the Department of Health. not the Department of Health, they have to send it to the Department of Building.
Who does the testing, like those, the landlord?
No, they have, you have to be a certified company to come in and test it, not everybody can
Yeah,
do it.
so the Department of Health is responsible, I mean, and Pauline, you can jump in and correct me if I'm wrong.
And
But-
Victor has his.
Yeah, and Victor, I think, is also on the call. But the Department of Health is responsible for overseeing like the Legionnaires prevention program across the city. But they are not directly doing the inspections, except in the case of like, you know, an outbreak where they bring in like some of their disease detectives to directly do the testing. Under general circumstances, they sort of, you know, allow building owners and landlords to do the testing themselves by contracting out sort of like licensed water ecologists and water scientists who will do the testing and then report that information back to the Department of Health. But what they do is they have, you know, there's no real, you know, regulations on how often the Department of Health is required to do inspections. And so what has happened in this situation is that, you know, a lot of the buildings, I think it was a majority of the buildings, actually 9 out of the 10 were not inspected. So they are supposed to be, you know, doing their own sort of, you know, maintenance and remediation if they see issues. But in this case, 9 out of the 10 buildings, including some of the buildings that were owned by the city, no inspections had been taken by the health department. So I guess the question that comes for me is like, you know, generally if you're supposed to be fulfilling some of these responsibilities and you're supposed to be being inspected by the health department, and if you're found in violation of some of those regulations, you're supposed to be fined and punished. But in this case, we found that the responsible party was the city. And so my question to Pauline is like, what do you do in a case where the source of the outbreak is a city-owned building? Like I would think that like a $2,000 fine is not sufficient for like Harlem Hospital pumping out Legionnaires into the community. So I think that's the question of like, if that's, you know, something for, you know, change in legislation to address, like why, like the city is even allowing some of these buildings to fall out of compliance. I guess that would be my question.
Yeah, I mean, those are great questions. Unfortunately, a lot of times we do see that city agencies are the most problematic, you know, across the board, not just when it comes to Legionnaire's disease with cooling towers. But I guess it would have to take legislation to make, you know, the ramifications stronger, or to give the health department, you know, more capacity to be able to conduct more inspections. Unfortunately, you know, it's the same old song of we don't have enough inspectors, we're understaffed constantly. And so it is a matter of funding, it is a matter of having enough staff to do this work. And so legislation can change and mandate a whole bunch of things, but if we don't have the capacity to go out there and inspect every single cooling tower all the time, you know, like things like this unfortunately do happen. So, you know, I'm not sure what the answers are, and I'm hoping that, you know, with your input with your local elected officials through legislation, things can be added, but also things that could be added in a way that would be actually viable, not only for our agency, but across the board, and for, you know, city-owned properties to be a bit more responsible for their own properties.
I guess we can go to Victor and then Mary Claire and then sorry.
Jordan.
Good evening, all. Can you hear me?
Yeah.
Yes. Pauline, thank you as usual for coming and attending meetings. Some good questions were brought up and some answers were given. I'm troubled by some of the same questions. In a prior meeting, I asked that which buildings, and I was told that Department of Health didn't want to alarm people by giving out the buildings, and they just would give out zip codes. The town hall meeting, Senator Cordell Claire asked the same question. She was refused. But now you're saying that they didn't know. I don't know which is it. They did not know, or you did not want to give it to us?
No, so yes. So in the beginning, of course, since investigation was ongoing and we knew how many cooling towers were in the neighborhood. And so we sort of, how the disease detectives work is that Legionnaire's disease is a reportable disease to the health department. So anytime someone is diagnosed, it's reported to us. And so we have people constantly pinpointing on a map cases of Legionnaire's disease. And so when they started to notice that they're seeing a cluster come up in a particular neighborhood, specific zip codes, then
Yes.
we deploy people, thank you, to legislation where we were, buildings had to register their cooling towers. We were able to go to all the cooling towers that were in those zip codes of concern and immediately ask them to remediate and clean their cooling towers, even before we knew what their samples said. So we took samples and then immediately asked them to clean and remediate. So all of those cooling towers within the affected zip codes were asked to do that. And the reason why we can't pinpoint addresses in the beginning is because we're not sure which ones were the problematic cooling towers. And sometimes you wouldn't even know at all, right? Like sometimes, if you aren't able to match up samples, you wouldn't know if there were one or more cooling towers that would be linked to a particular case. And in this case, fortunately, we were able to get samples from patients and match them with the DNA to samples from the cooling towers. And so we were able to identify, at least 2 of the cooling towers in the neighborhood that may have contributed to.
So my question to you is,
Yeah.
what was the time frame between when you found out what exact buildings they were to when we were notified?
So
'Cause
again,
uh-huh.
the policy is that we
That's
don't.
a yes or no answer. That's
No, I
when,
mean, so
yeah,
I think
when,
things changed a little bit in this particular investigation where people were pushing to have specific building addresses. And
correct.
so we, as an agency, never gave out building addresses in previous investigations, again, under the caution of making sure people in the entire affected area, all the zip codes were concerned, not just people near or around specific buildings. And so that's why, as an agency, we always were very careful not to provide specific buildings and to make sure people in the affected zip codes were all
Right.
there.
But you gave them out eventually.
Yes, because in this particular investigation, the elected offices and the mayor's office really
Yes.
pushed to have that information shared. And so that's why I think the information was able to be released, but it's not,
Okay.
to be
So
honest, it
normally,
was not something that I think our agency really felt would be necessarily helpful to the community because we wanted everyone in the affected area
okay.
to make sure that they were aware and taking care of their health and really paying attention to how they were feeling. And I think
I,
having specific addresses out there would either make people overly anxious if they were nearby or not anxious at all if they weren't close by. And so so as a policy for the health department, it was always more, we sided on we cautioned and we wanted to have a larger scope of the
okay.
investigation shared with the community as
Is
opposed
there
to
any, let me just cut you short on it. Is there any thought of changing that policy? And I say that because 215 West 125th Street holds the Emblem Healthcare Center and Lenox Hill Radiology, 2 places I visited during this outbreak. Had I known that, I probably would not have visited that and stayed in my district, my zip code, that was much further away. Follow me?
Sure, I
Yes.
absolutely understand.
Does
I
it
think,
make, does that
yeah,
make sense what I'm saying? I would have not gone in that building had I known that.
right, but it's not, so again, I think this sort of highlights the point that it's not a specific building that's the issue, right? Like the
But,
Legionella bacteria is very common in the environment.
okay, let me just say
And
this. The
no, I
likelihood,
understand your point,
let me
but
finish speaking. Let me finish. because you're going on and on. What I'm saying is the likelihood and the statistical data of me contracting this, I would say would be higher the closer I am to a building that's infected. Would you agree with that?
I don't know if that's necessarily the case. It would have to deal with your
Okay.
overall health, if you have underlying health conditions, how much time you spend in a particular area, since it's in the environment,
All right.
you know,
Okay,
wind
I don't
speed,
want to take up too much
humidity.
more time. My
No,
other
so
question,
but I think, I'm sorry, I don't mean to interrupt you, but I think this is why having specific buildings might not necessarily be the most effective way to communicate information, because we don't want people to stop living their lives. Again, yes, Legionnaires is a very serious disease, but
yes.
most healthy adults, we come in contact with all types of viruses and bacteria on a regular basis, including Legionella bacteria. And it really only develops into major pneumonia if you are if you do have underlying health conditions, if you know, are over the age of 50. And so that's why we want people to just pay attention to how they're feeling, not avoid, you know, everyday life. And so I think this is why having too much information sometimes might not necessarily be helpful. And I think having people in that entire affected zip code is much more beneficial, so that everyone can pay attention to how they're feeling and everyone can still go about their day without anxiety, but really understanding that they can pay attention, make sure that they're feeling well, and if they're not feeling well, go seek care.
So I have to wait till I'm not feeling well then. As I said to you before, I went to Lenox Hill Radiology, Emblem Health at 215 West 125th. Had I known that, I wouldn't have gone. That should be my personal choice, instead of exposing me to that, saying, oh, it's in this zip code, but not saying which particular building. My other question is, seeing that three of the buildings are city-owned buildings, health-related, is the health department going to increase inspections in their own buildings, let alone buildings outside? Has any been talk about that? I think it's
Yeah.
appalling that Harlem Hospital would be infected. They should be checking every week if necessary. I mean, that's, to me, it's just outrageous. It's not happening at hospital Lenox Hill downtown. So why is it happening uptown?
And I think to Victor's point, I think there was like a lot of data on this, and I think it sort of goes to a question that I have is, over the past, 10 years since like the 2015 outbreak that prompted sort of these regulations to come into effect, there have been sort of, at least as far as I was able to find out, like 8 outbreaks of like community spread, like large Legionella outbreaks, and 7 of the 8 of those outbreaks have been in either Harlem or the Bronx, in northern Manhattan. And so I guess the question that I have for the health department, and obviously Pauline, not to beat up on you specifically, I know a lot of these decisions are being made like at a higher level in terms of like, prioritization by the city overall. But, what, when you're dealing with limited resources, dealing with limited inspectors, how are you deciding what buildings or what communities to prioritize? I guess I would think that like if we have a community that has a history of like, multiple exposures, multiple outbreaks, that we would be prioritizing, uptown. If this is like we're seeing like the vast majority of these sort of community outbreaks happening. And I was wondering if that's something that goes into the decision making when you're trying to allocate those limited resources.
Just to
I mean, that makes sense. I don't know the answer to that, but I'm happy to find out.
The young lady.
Yeah, I think Mary Claire, we have.
And then we have Janera and Jordan.
Yeah, Jordan, Janera.
Oh, was Jordan before then too?
Yeah,
Quickly.
go ahead, Mary Claire.
Yeah, I'll go quick. Thank you for having me. This sort of directly correlates to Cameron's question in terms of prioritizing the area. But in terms of staffing issues, I'm wondering how or what solutions look like to fill those gaps. Because I do know, I mean, Central Harlem and Parkchester Bronx, like those Those areas aren't the only areas in the five boroughs that have city buildings. So there have to be inspections occurring in other places, but I'm wondering if there are any steps to address training or workforce development or filling those gaps where there is a dearth of people to carry these things out. In addition, like Cameron said, to prioritize areas that seem to get hardest hit time and time again whenever there's an outbreak.
Right. I mean, I know we're actively looking and constantly, hiring or posting positions and hiring. But I think it's really hard to find, candidates that are qualified. I believe there are certain educational requirements specifically for this particular inspector position. But also, the city doesn't really, the salary isn't as competitive, and so it's really difficult to find and retain staff. But of course, that's not an excuse either. And so if you have any suggestions on how we can do a better job of making positions and openings known to the community or to anyone who might be interested in working for the city, please let us know, because recruiting has always been really difficult for our agency.
Sorry, I had one question and then several more came up. So I'm trying to go real fast. First of all, thank you for all your work on this. I know there are a lot of people very mad at you, and I know it's not your fault personally. I know you aren't the one getting people sick, and I want to acknowledge that you are trying your best. I guess my first and most basic question is, this is a very interesting case of public health in which it's very easy to pinpoint fault. It takes time, of course, but we know the addresses of the buildings. So I guess my question is, you said that over 100 people were hospitalized. Who is on the hook for those medical bills? I assume it's the buildings that got them sick. And two, you talk about how expensive it is to do all of these inspections, but I know how expensive healthcare is. Isn't it more expensive to pay for all of these people's medical bills once they get sick? Or are we, so I guess in my head, the only way to square that circle is that we're just kind of leaving these people out in the cold to pay their own medical bills? Is that what's happening?
What's the latest on that?
Yeah.
Let's hear the.
Yeah, like are we, these people who are hospitalized, and I had another question about people who are over 50 and have other ongoing health concerns, just having to be aware of how they feel, because people over 50 with pre-existing conditions, historically not a group that already feels like shit all the time. So that was another thing that confused me a little in your explanation. But yeah, who's on the hook for the medical bills?
We'll see.
Pauline, did you have a response to that?
It would be the individual. I don't know if there's any case. I mean, I guess that's why maybe the Reverend Al Sharpton is suing. I don't know, but I mean, there's nothing to suggest that, the hospital or any other building that might be responsible would be footing the bill for medical care.
That would be, in that case, the legislation I would suggest, because it seems like the city will go with whatever's cheapest, and I know that the landlords will go with whatever's cheapest. And it feels like this is a case where prevention is a lot cheaper. And
Worth the pound of care.
I also, yeah, exactly. I guess my final follow-up question, and thank you for letting me use a ton of time, is you mentioned that when you went around to all of these buildings to collect samples, you politely, pretty please requested that they inspect and clean their facility. Of those buildings, what percentage has confirmed and sent you proof that they actually did that?
All the buildings provided information.
Okay.
Mhm.
So all of those buildings.
They all complied, yes.
Great, that's good to know. And of the buildings that weren't registered, you mentioned that some of them had cooling towers that weren't registered.
There was just one building that was not registered.
Was that a city building?
Yes.
Which building was that?
It's the one that is right on the Harlem Hospital campus that is under EDC right now.
Yeah, and I know that the public health department puts grades on restaurants. Are there grades for buildings? Like, if I am like looking at apartments in New York, can I see a grade? Like, hey, there
Yeah,
are.
that's a really good suggestion. Not every building has a cooling tower. Some buildings have
Are there
grades
grades of, well, this
for-
building can be sick if I live there.
Yeah, I mean,
Or
so
I don't fear at the hospital.
Can you
Yeah.
easily get a list of inspections that buildings are supposed to do? To see if they were done and get a date
So-
there.
Because
yeah,
we
there
ex-
is a database on the internet. It is running on a delay though. But yes, there is an actual list of every single cooling tower that's registered with the Department of Buildings. And there is information about inspections of cooling towers. But again, that information is on a delay. So, but I mean, having a letter grade is a very interesting idea. I think that might be helpful for buildings who do have cooling towers. But again, there are also internal building investigations that we conduct where it's a building's, hot water supply that might be the issue. So when it comes to the cooling towers, it's really the environment that's more affected. And so that's why we give the broader zip code information. But when it's a building particular specific investigation, it's the internal water that is a situation for that. So there are two different types of investigations that we conduct at the health department. And so, just because, again, your building has a cooling tower, you being inside the building, you're not as affected as when you are outside. So I think there's a little bit of clarification that is needed there. But I think it's a great idea. It's a good idea to maybe have more information available to folks.
You can make a comment.
You're all good?
No, I'm okay.
Okay, was it Monica?
Did you have a question still?
Yes, so originally 10031 was not on the list of zip codes. And it was added late, and the only reason why I found out about it is because I was walking down the Frederick Douglass and 144, and it was in the linked in kiosk. So, I'm not saying it's your fault. I'm just saying, what is the health department going to do so that the next time more information gets out? Because we needed to know that 10031 was on the hit list too, and we did not. Right.
Yeah, I mean, I think, as the investigation is ongoing, information is added or, additional zip codes were added. I think putting it on the link NYC probably was a way to get that information out. Of course, we rely on the media, we rely on our local elected partners, to try and get that information out. We did flyering, we did active flyering campaigns. We worked with, every partner that we had in the neighborhood. But again, people, have always said that they don't receive the information or they weren't aware of the information. So again, we can do a lot better in terms of communicating information. And if you have any other suggestions on how we can do that better, we are always open to those suggestions. I think we tried our best to make sure that we got provided information in a timely manner. We had, we had biweekly meetings with elected officials and the community boards. And so I think we tried our best to be as open and communicative about the ongoing situation. But of course, more can always be done.
But yeah, I just want to say that. But here's the problem, Pauline. I am on Facebook. I am on Instagram. I did follow up. I listened to the press conference. I never heard 10031 mentioned. It was never mentioned. So, I understand getting the word out, but that word was not out anywhere else other than the LinkedIn. So if you weren't down on Frederick Douglass and 144th, you did not know. And that's where the problem is. It's true.
Yeah, was there, I guess, to Monica's point, was there like any miscommunication between like the different communications folks? Like what was going on to the Link NYC towers versus what was going in the press releases versus what was being communicated to the elected officials?
Yeah, I don't know if I recall 10031 being added, and it's not in any of our online communication. So I mean, honestly, I don't know if that was a typo from Link NYC, but that could also be an issue as well, right? So I don't know. I can look into that.
Yeah, I mean, if we're talking about 131 and if City College, that was my understanding, there was a building on the City College campus, I mean, that's a big deal. I mean, that's a campus. You have students and faculty as well as residents who live near there. And to Monica's point, I didn't even learn anything about that until somebody came up to me. So that's pretty big deal. I mean, everything is a big deal, but particularly that's as you know, so.
And it seems like they announced it themselves, but that I recall.
Okay.
It seems like City College put out a notice.
Mhm.
College did.
Yes, like somebody from the city at all.
Edwin, you had your hand raised?
So I think that, Pauline, that, we want to be very clear. This is not us attacking you. It's not about you. We know this is a system failure. And I
Right.
think that, this was about the system that allowed, contaminated cooling towers as city run facility to spread through our neighborhood. And we lost lives. And that didn't happen because we are unlucky. It happened because of oversight. It was
Mhm.
weak. The warning system were delayed. And we, didn't prioritize prevention, to treat, and also to let folks know. Just to put an entire zip code and say, well, such and such zip code was not enough. This is not an issue of not having enough manpower. I think that DOH is trying to evade responsibility by doing this. We need more answers here. I think the community, if we want to be truthful at preventing this in the future, we should do some self-reflection instead of continuing this narrative. This was a lack of personnel, a lack of resources, and not looking into precisely what happened. Right? When
Right.
you
I
point,
think,
when
yes.
you point, and I know that this was not, the narrative that you came up with. We can see it in the newspaper. This was from the top down. But I think that, we cannot be distracted by this narrative of limited capacity. This was preventable. It is preventable. And we must treat such failure in leadership and hold people accountable. Our community deserves better. We all deserve better.
Absolutely, ditto.
Yeah,
Yeah.
Pauline, did you have, I think you were about to say something.
No, I definitely agree with what Dr. Torres is saying. And of course, what the entire community is feeling, of course. And I think those conversations are happening. So, but of course, accountability, more accountability needs to take place. And I think prevention, of course, needs to happen.
All right.
Sure, let me just bring this in camera. I'm not sure if you saw it, Pauline, but our committee introduced a resolution on Legionella cooling center testing. Highly drafted from by Cameron, I believe, and we just added to, but I think this is the one that Cameron put together, because I know WEAC has been heavily involved with this and with the environment. And so we appreciate it. It was sent to Dr. Michelle Morse, who, I'm not sure if she's acting. Yes, she's acting health commissioner. I'm not sure if you got a copy of it. If you did not, we can send it to you. And I gotta make sure, we've done a lot of resolutions out of health committee. And so maybe you're not getting some of it, we need to double check that. Because again, it's even with us, it's a top down, we're hoping that we certainly want our city council person to be aware. And our state and city representatives, so they all get it, and congressional ones. And so that we have put something forth to them. I'm not sure, but we'd like for you to be able to take note of everything that was discussed here, and if you can get that from as a liaison, you can liaison that information again to your higher ups. That would really be important, and come back and maybe make some suggestions as well. Jeff Janera?
Yeah, this is, I guess,
Absolutely.
more of a suggestion for the future, just because, when you look at the map, like, obviously you're like, oh, I'm in this zip code and this is the boundary line, but I think that, like, the way we move around the city is not so, like, I'm in this zip code now and outside of this zip code. So it could have been helpful, like, in terms of, like, public health awareness to, like, map out to the extent that you think that, like, from this zip code, it could extend to another one, or, like, affected areas, not just areas that that tested positive.
Like a heat map, like a
Yeah,
red, orange,
yeah,
yellow,
exactly.
risk map.
Yeah, like it could spread, from this zip code to these other zip codes, even though it's not there yet. So people are alert. Because I personally, I go grocery shopping in Central Harlem, and I was like, oh, okay, I guess I don't know what's going on, so maybe I won't do it there this week and figure things out. But I still move through these zip codes, and like you mentioned, our zip code was also affected, and we didn't know about it until much later. And even how it's expanding into the Bronx, and there's a high asthma rate, so bring a better picture of how these things are connected. Would be more helpful to help people make decisions about their health. It's to yeah.
I think,
So with that, are there any other questions or comments on that, Cameron?
yeah, I was gonna, so, I mean, I think that, yeah, I think Janera's point about sort of, zip codes are invisible to folks, so it's, you're not aware of what zip codes you're moving through, and I think that potentially could have led to some of that confusion of you seeing 10031 or seeing that you're 4 blocks away from a building that's implicated, but your zip code is not on the list of vulnerable ones. But I think, ultimately, I think I am more sympathetic, I think, to the notion of that this is something that has been chronically underinvested in. Of detection, of inspections, of remediation, because we do have the data that there has been large attrition since 2017 of health department staff, particularly since the pandemic. And there has been, and we aren't paying competitive, rates to folks who would be doing this work. We also aren't training folks to do this work ourselves. There also, Pauline, I think there might be, some work that could be happening on the department in terms of whether we really need to be asking for the level of credentials that we're asking for, whether this is something that we can, have specialized training for community members to participate in. I think there's also, worth looking at, Mayor Adams came out with a whole suite of proposals that he wants to do in response to this outbreak, but maybe wasn't investing the resources into hiring folks prior to the outbreak. I think that's something to look into. But I think ultimately, I think the thing that comes up for me is that, if it's obviously it's about the city, but I think when we step back from sort of Legionnaire's disease as an issue of community spread and look at it, the individual cases that are happening every day in just every building with a hot water tank, we see that this is something that happens far more frequently than is reported in these dramatic ways. And I think it comes to a building management issue, and whether there should be more stringent regulations or enforcements on an individual building level for all of the different, because the Bronx case that folks brought up, that's not a community spread case. That's not a case of, Legionnaires in a cooling tower going out to the rest of the community. That's a case of Legionnaires in the water heater in an individual building going to tenants in that building through the shower and all the other systems internally. And that's something that is, there is no regulation. There's not the specific regulations for cooling towers are only for buildings with cooling towers. If you just have a water heater and the Legionella is throwing water heater, not really, a place that you can look at it on the city or even like stringent requirements for testing. And I think that all of this stuff, the reason that I'm bringing up all of this stuff and bringing that in is that I think that there's, number one, you know, right before I left with WEAC, we were starting on like working with an organization called Upper Manhattan Tenants Union, to try to get folks like more organized and informed about some of the rights that they have and some of the ways that they can work together collectively and protect themselves from some of the impacts of Legionnaires amongst building owners, whether you have cooling tower or not, you're going to be exposed as somebody who lives in this community. And I think the really specific thing that I wanted to indicate is that there's actually, for folks who are interested, there actually is going to be a city council hearing on this Legionnaires outbreak. And I think that it would be a shame if folks from Harlem are not heard at the city council hearing.
When is it?
Yeah, so and I can send this information out, but the hearing is scheduled for September 19th, Friday at 10 a.m. That's it's all with, generally with city council hearings, there's like, you can either do it in person or via Zoom, or you can just type up your testimony and send it in. So if you can do it completely synchronously or asynchronously, it's like it's whatever you want. But yeah, you can go council.nyc.gov/testify. You can find that hearing. There's gonna be a hearing on Legionnaire's disease. And you can sign up to go in person, you can sign up to testify via Zoom, or you can sign up to submit your testimony via email to the city council email address.
Are you gonna testify?
I was hoping to.
Okay, great.
But, you know, I think that this is something that like the folks who are crafting the laws and the folks that are coming up with these policy proposals all of a sudden in response to this crisis, I think should really be hearing from community members about,
Yes.
you know, about the causes of this crisis. But yeah, I think if there's no more questions on this, we probably.
Yeah, we'll move on, and then, Holly, I know we put you.
Right, if there's no more questions about Legionnaires,
Oh, that's.
can we ask
right,
her,
right.
can we ask her to touch
Yeah.
upon? Oh, sorry, go
Yeah,
ahead,
that's
Chair.
No, I was gonna say, do you have anything quickly, measles and immunizations based on the latest with, CDC, cause it affects us.
There's a
locally.
measles outbreak at City College.
Yeah, we mentioned that before you came. Yeah, I thought it was only one, when I mentioned it earlier, I only mentioned one, but if it's an outbreak.
Oh, my Lord.
Or any vaccine.
What do you know about, measles in Manhattan, in the city, Pauline?
I don't have any updated information about measles specifically, but I will definitely look into that and I'll email you and the committee, of course, any information I have. But of course, we're always advocating that people, especially after COVID, you know, get their kids back on a vaccination schedule, especially for the MMR vaccine. And so that's information that we have always been trying to share with the community. And then also when it comes to the COVID vaccine, the governor just, you know, signed her executive order on providing access to all New Yorkers. And so the city health department also highly, you know, wanted to emphasize that New Yorkers in New York City will be able to have access to the COVID vaccine despite what the federal government is pushing.
Press or flyer on that, with the vaccines, because otherwise I'm sure there's a lot of confusion right now.
Yeah, we do have like a statement that I can put into the chat to share with you.
Will there be flyers developed, for?
I believe we're gonna be working on that information to share with New Yorkers because we do know that people are quite concerned.
Yes.
Jordan?
Is the new vaccine version out at like Dwayne Reed's all over yet? And if not, when is it going to come
No,
out?
it was not at CVS, I know that, because I was
Yeah.
scheduled for this morning, they
They haven't.
cut it out.
I will find out and share that information.
Now Moderna, they have more Moderna at some
Only
places.
they
Yeah.
are already in some pharmacies. They have the flu vaccine.
That's flu and what about
No,
COVID?
the newest COVID
The
vaccine.
newest COVID, I have not heard anything yet.
Yeah, they canceled.
Right, I
it.
haven't, I haven't either, so I'm gonna look into that and I'll share information with you all.
And the thing with the COVID vaccine and the governor's executive order is that they're still working out because, because of the HHS that we're dealing with right now.
Right.
It's still not entirely clear if even under the order sort of allows pharmacists to prescribe the vaccine to anybody who wants it, but it's still not clear if the directive is coming from HHS, whether it's gonna be covered by insurance or not. So I think that's still something that, at least as far as I know, that they're still trying to figure out.
Wow. And it's interesting, when I signed up at CVS for my COVID, flu, whatever I could get, they're asking a lot of questions, about your neighborhood, race, yes, all of that. So to me, it sounds like as Cameron referenced our HHS, it seems like something's going on there where they're really trying to get underneath who is getting this. I had an appointment, even though I wanted uptown, the appointment they gave me, which I ended up canceling, was down in the village. In the Harlem area, that's where I went first. They did not have the COVID vaccine at the CVS. The CVS is in this area. They said, well, we did have them, but it's gonna be a little while. And they gave me that look like, okay, something's going on. And so, we know underlying a lot of the negatives dealing with health, people of color, underserved, that's definitely there. So, we have a struggle still.
Were you required to present a prescription from your medical doctor?
That was part of it, but I didn't have to.
Okay.
But it was on the form, and I can't recall which one. Certainly, children and forget the other group were required for signatures. They were asking a lot of questions about whether you're born here, legally here.
So if someone doesn't have a primary care physician, they can't get the COVID vaccine?
Now they
No,
can
that-
given the
yeah.
executive order. That's the.
Because
Yeah,
of the-
but only
because
at
of the-
pharmacy,
Okay.
hospitals are
I
not,
don't need
they are not
it.
giving
Great.
COVID shots.
Right, only farm. That's the big thing.
We're terrible.
But in New Jersey and Connecticut, from what I understand, anyone can get it at a pharmacy. So I don't know, I think it's New York has failed to be out there right away, right? California, Washington State, they immediately overrode what happened at AHHS.
No,
from my
I think
understanding.
the problem is CVS and Walgreens, they have their marching orders. And they're really not trying to table a Trump, so. I don't
But
think,
in other states, they're doing, like, in New Jersey,
but
people are
there-
walking
there
in.
is,
Yeah, yeah.
walking in, I think it's not a lot, I think you have to get them.
And they
Yeah,
get
yes,
those
it was
other
a
already.
Just to be clear, the issue, at least as far as I know, is not really like, yeah, in New York, New Jersey, a lot of these states, like you can get it if your state sort of like allows you to get it. But then there's like whether it's available to you, it's different, but
Yes.
than whether it's covered by insurance. And I think that's the thing that like can vary state to state, network to network, provider to provider. Certain providers will make the decision like, oh, we're gonna cover it, even if, HHS has said that it's not recommended because we're gonna take this guidance in the state. Certain insurance providers will say, actually, no, we're not gonna cover it. So I think that's the thing that like results may vary based on like who your insurance provider is.
Will you get kind of like, early in the pandemic, I had an issue where some idiot at my Walgreens wasn't able to find my insurance, and I was like, okay, I'll just pay for it. I don't care. Please get me out of this Walgreens. I've been waiting 2.5 hours. And they just refused to give it to me for 45 minutes, and I had to make a scene in Walgreens to get a COVID vaccine. But like, if you find out at the counter that your insurance doesn't cover it, are they just not gonna give it to you, or can you pay out of pocket? Cause I don't wanna get sick. I'm happy to pay whatever it is out of pocket.
Oh, it's a free country. You can always pay for it.
No, not always.
Yeah, I was gonna say, it really depends. on your-
Walgreens told me early in the pandemic that it would be illegal for them to charge me for the
Yeah,
vaccine.
that was early in the pandemic, that
Yeah.
was when people were scrambling.
The pandemic has different jurisdiction because there were different folks who were prioritized.
Right.
So depending on when you went to get the vaccine, you probably were not on the high priority list.
Oh,
But this is
this
from a
was not the
pharmacy.
issue, was their computer broke. Like,
There is a lot of variation.
Yeah.
There's, because of the chaos that is happening at the federal level, there is a lot of different guidance that is coming down. So like genuinely, like your pharmacist may not know what they are or.
so it's gonna be that.
Results may vary, it's like,
Yeah.
it's like very real, like it might come down to like you might be legally technically able to go to this, but you might actually have to go to a few pharmacies. Is to get one who is willing to like, do this if they haven't even heard of the executive order. Like these things are take a while to trickle down to the individual.
Insurance carrier.
Yeah.
What'd you say, Heather?
Just check with your.
Every time
insurance carrier.
I check with the insurance carrier, it's lies, like, they have lists of hundreds of doctors that are close to your business, that are taking your patients and not.
Do we have any other things for all of you?
Yes, I do, Mr. Chair. Pauline, we have, and I, spoken to several folks, at, tenant association at 260, and the food trucks are, the hygiene, I believe it falls under DOH. And inside City College, there is a food truck. Now they're on two corners. And these food trucks, they have been there for at least 6 months without moving.
Oh,
And
okay.
to my understanding, based on the DOH, they're supposed to take them to a depot and clean them.
Yes.
And this is very concerning because here you have City College that has been ground zero for Legionnaires, now measles, and there seems to be probably a wider issue when it comes to public health, and how that the university is looking at it. But can you clarify that with these trucks? Are they supposed to? How does that work with the food trucks and
Yeah,
the
so if
hygiene?
Yep, if it's a mobile food truck, they are required to return to the commissary within a 24-hour period, and they have to show proof that they went to the commissary to have their truck cleaned and to have their food replenished.
Yeah.
So if they cannot provide proof that that happened, they get issued a violation, and then multiple violations, and we can take their truck. But if you don't mind, Dr. Torres, can you send me that information via email, and I will make sure our mobile vending team goes out and conducts an inspection?
Yeah, we'll do, because some of the folks that reach out to me, they were concerned, not about 24 hours, but they were like, it's been here for months and it has not
Yeah,
moved. We're
right.
just,
Do you know if they're mobile or if they're one of those like structured kiosk type things like in parks?
this is like a big, one of the big food truck.
Like a food truck or a
Oh,
push cart? Okay.
yeah.
Okay, if you don't mind just sending me that information, and I will ask our team to inspect as soon as possible.
Okay, we'll send it over. Thank you.
Thank you so much.
So, just to wrap up this section with Pauline, Pauline, can you send as soon as possible, whatever you have, and if it's a flyer? Because, the executive committee meets next week, and so we'd like to present, it's this week, that means like, over the next couple of days. So that we can, present it and have them see it first and know what, will be disseminated at our general board. So whatever you have on the three areas that were discussed tonight. And then, I didn't see, Governor Hochul's letter, that'll be great. Well, no, it wasn't, was it?
I can add it into the chat.
Okay, great. And then there was one other thing. I think that's anything else that you have on Legionnaires that we need to know as a community, that'd be super.
Will do.
Thank you, Pauline, appreciate it.
Thanks, Pauline.
No
Um,
problem.
So some of the things can be saved in the interest of time for next time. I had them here as there's so many topics that we need to be on top of, but just so that all the new members know, our committee has been very active in terms of resolutions, and over the last several years actually. And we've been very active in seeing what's going on with the community and trying to give a voice to some opinion, especially if we think it's going to be detrimental or is detrimental. And that is so important. Our big issue to me, and follow up, and I'm sure to others as well, is accountability. You know, who we do the resolutions, but how do we follow up to know really, unless something happens, what has been acted on? And so in light of all of that, and Edwin and I talked about it a lot in the past, and you know, he's done so much on this. I said, Edwin, can you talk about true accountability for our group? Because I think that should be our theme this year. There is so much now that's on the table for us, whether it wants to be or not, or certain things are forced on us to act on. And some things we did, I know last year, trying to get ahead of what might be a problem. We're not trying to wait for a problem. We're trying to see a problem in advance. Please, please, please. I can see that this will be, you know, a well, hard thinking group, interested in the community, and just bring it up. And, you know, we talk about it, discuss it, and perhaps can come up with a resolution, or others will come to us with letters of support. And we want to give it, especially if it's one of our institutions. We're not trying to hurt people, but if it's not good, we'll say it's not good. That's what we can't do. But if they've been doing great work and funding is so tight, we want to be able to help them. And we did a letter of support for IBREA Foundation during the month of August, when the entire general board did not meet. As I mentioned, Cameron whipped up our reso on the Legionella cooling towers. So we're able to get that out. And you see there's more done on that. And he's kind of an authority, especially having been a fellow at REACT, and just with his own knowledge and information, a real great source for us related to the environment. There's a lot that's coming down. So what I'd like to do right now is two things very quickly. Coda, Dina Lynn, real short. I'll try and make it as short as I possibly can. And then Elizabeth Rodriguez. I think Elizabeth first. I think you're already. I think it didn't show up this way, but I know that you had sent it in first. So let's just try to be real quick, because I want to make sure Cameron feels that he got his accountability dealing with climate justice environment already. And so we have Dr. Torres who can wrap this up. And there is a possible letter of support or reso. So let's, I think we can try to be done in 30 minutes with everything. Okay, it's 8:01. Okay. Well,
Yeah,
okay. Do you need to be made you need the screen or anything?
yeah, I'll go through it quickly.
Okay, so you don't need the screen, Tina? No. Okay, so while we get set up.
Okay.
Yeah.
Okay, and then Dina Lynn can speak, and that Elizabeth, can you email?
Yeah.
Okay, Dina.
Okay, so first I want to say I'm really happy that I showed up this evening. I've gained so much information. I live in Parkchester, and there is an outbreak of Legionnaires in my complex that I didn't even know about until past, everything had been done. So this is a serious situation where they're not letting people know that there is health threats circulating within the places where they live and eat and sleep. So thank you. I'm really glad to be here. My name is Dina Lynn. I am from the Coda Alliance. The Coda Alliance is celebrating 10 years of being in Harlem. But at the same time, we are also celebrating some brand new things as a part of the Coda Alliance. I am the health and wellness consultant, and as we are talking about staying well, keeping your immune system strong so that you can fight off whatever they're throwing at us or not letting us know that is circulating amongst us. The Coda Alliance is now offering health and wellness workshops and programs. So there's a long list of things that are coming up. Our next wellness offering is a quarterly potluck community event. Free, open to everyone. It's a very intergenerational experience. Each program or workshop that we curate usually has a theme. And so since we're doing it quarterly, this is our fall offering. And so the things will be based on getting prepared for the new year. And we invite everyone to attend. We just ask you, if possible, to bring a dish. We just finished having our digital Reiki offering. Again, just unity is open to everyone. Accessible because it is digital and it is in the evening, so you can just come and relax, decompress, de-stress, reset, and on camera, off camera, come as you are. Again, very much themed. Most of our health and wellness offerings include some mindfulness practices, some breathwork practices, meditations to help you to clear and to ground and set you up for your week. The Reiki happens the first Wednesday of the month. And as I said, we just had our Reiki offerings. Tomorrow we are launching a digital yoga class. It's a yin yoga class. I will be instructing this class. Again, it is open for all levels of experience with yoga or no experience with yoga, because this is a class. It's called a yin yoga class, and it is primarily to help you to restore and to have a deep, relaxing evening before bed, to help you to rest better, and also, again, to help you to prepare for the rest of the week.
When is that?
We have also happening after yoga.
When is that?
That is tomorrow.
That's the only time.
Tuesday, yeah, Tuesday, 7 to 8 p.m.
Okay.
If you go to the CODA website, you can see all the offerings and register and for the Zoom on the Eventbrite. Yoga is also taught on Saturdays at the CODA Alliance at 10 a.m. Another free class for women only. Later this fall in October, we are also offering an open house women's wellness event. This will be our fourth event. They're usually really successful. You know, we have the community come in to receive refreshments, gatherings to meet folks, but also to get some acupressure, some acupuncture, massage, Reiki, oral clearing, primarily holistic wellness and integral medicine. It is again a wonderful, wonderful event that we started just last year, and we hope to expand it. Space is limited, so if you're interested, please register early.
Is there a fee?
For the fee for the open house wellness, you can bring a friend and the two of you pay 25 for the kids. Those are 2 for 1.
And that's when again,
That is October, I believe it's.
oh, it's another event, so you have a flyer that will come out?
Yeah.
Okay.
We'll have a
please
flyer
do
for
that.
that. Okay, and last but not least, I wanted to let everyone know that, we have a grant for a teen program, and our teen program, at the Coda Alliance offers trauma conscious wellness programming, for BIPOC and, gender nonconforming girls ages 13 to 18. It's supported through health and wellness, creative art practices, herbal medicine, aromatherapy, and somatic practices. We are hoping to partner, with, what is it?
Allergies.
I'm sorry that we held that. We're hoping to partner with after school programs and other organizations so that we can offer this as a part of an after school program. We started this these program last fall in a grant. Let's bring the seed by the teams, showed up on Saturdays, which is hard to get the teams to come on Saturdays. But they came, they participated, and we had a really great time with the teen girls. We ended our session this year with a podcast for the teens. They did their own podcast and had a great time doing that. So as quickly as I can, please, the website, go to the Coda Alliance website to take a look at all the different things that we're doing. This is just the health and wellness. The arts and culture are also driven by a health and wellness a mindset. And so this particular aspect of the Coda is new, where we are really leaning into holistic wellness and integral medicine and introducing that to our teens as well as to our seniors and to the parents.
Okay, you might want to mention that the seniors part as seniors committee meeting. They meet during the day or have something and invite them up. That could be a nice
I
little trip for
definitely,
them.
I volunteered for the last
Okay, Walter.
it was fabulous. I loved it, yeah.
Okay, so Walter Alexander and Paul, son, what's Paul's husband?
No.
And
Walter and Vanessa.
oh, Walter and Vanessa then are co-chairs of the senior action. Actually, it's called older adult action, something like that. But if you call the office, or else I can get it to you as well.
I would love that.
And then, I don't know if, Wendy Millette is still.
Oh, I would say the Youth and Education Committee as well, for the young people.
Mhm.
Yeah.
Great.
And they meet next week, I think on, is it Tuesday?
Tomorrow, I think.
Yeah, they might.
Oh, wait, sorry, it's tomorrow, sorry, you're right.
So you might wanna try to schedule something, I'm sorry. With them as well.
Whatever help that we or I can receive in helping to share this information and get more
They
people
meet
of
tomorrow
color
at
in.
6:30.
But they meet here, probably tomorrow, I mean,
Here in
maybe
this
you can
room.
make a quick
I
announcement.
have my yoga class.
Oh, okay, so just get the contact email information.
Okay.
I'll try to remember to send it, but call the office otherwise.
Absolutely, and I thank you so much.
If you share something that I can mention it
I
to.
appreciate it. Is it okay if I give everybody a flyer?
Yes,
For sure.
and now while you're doing that, were there any other questions? I wanna try to move this along. Thank you so much, Tina Lynn. And we hope to see you back here.
Yeah, I mean, I got
Absolutely.
so much great information. Yes.
Okay, so now Elizabeth Rodriguez of Northern Manhattan Improvement. And then, right after her is, Dr. Torres, I forget. It will be hopefully as long as,
I'll try to be brief.
Yeah, too. Right.
Yes.
Okay.
So,
Elizabeth.
so thank you, yes, I'm Elizabeth Rodriguez, and I work for NIMIC, or North Manhattan Student Corporation. We have.
I'm sorry, hold on, she did, yeah.
Come over?
Yeah, like in the front so you can project out this.
Oh, okay. All
They're
right.
gonna be competing with the train too.
Oh, yeah, okay, then okay, that's it.
Oh, just turn around and speak to us, so we can just hear you and see your
Okay.
beautiful face.
Oh, thank you for that. So, I am from a settlement house called Northern Manhattan Improvement Corporation. We've been around since 1979, and we have a whole lot of different services. Two categories of those services are health and holistic, and that's what I'm gonna focus on today. So we have, navigators that are able to, apply and also be certified for Medicaid, emergency Medicaid. We also have, specialist that comes on Thursdays from Single Stop, and she is a specialist on Medicare, Medicaid. That can get complex, so that's great to have somebody to be able to clarify all the details for you. We have also, community health workers that work, with people that have chronic conditions to help them navigate the healthcare system and connect them to community resources. We also, have, I'm trying to go through this from memory instead of looking, counseling services or therapy services for individuals and for groups. All of our services are for free, and, oh, if we can skip to the. Yes. We have a food pantry, we have a domestic violence program, and we have a, health advocate that can also assist if, let's say, you have a bill and you don't know what it's about, or you don't have money to pay it. Information is that, a lot of the hospitals have, grant money for people who have low income. She can help, navigate that, situation for you and help get that paid, or just other questions that you don't know how to navigate, she can help intervene and mediate for you. So even something as simple as, trying to figure out your PIN on your, card or whatever it is, if you don't know how to do that, or, you know, you want help, she can help you do that. So,
That's the CHW or the,
community health worker, yes.
okay.
They work, mostly in conjunction, but not exclusively with, New York Presbyterian Hospital, so people from other hospitals or clinics can take part in that. So basically, the criteria for that is to have a chronic condition, let's say high blood pressure, asthma, diabetes, things like that. If you, I used to be one, so I can share some information with that. Basically, let's say somebody needs a specialty doctor, they don't know how to go about that, so I would teach them how to fish, not give them fish. So I would sit with them, call their insurance with them, and ask them for, you know, the specialty doctor they're looking for, write down a name, a few numbers, and then in order of preference, we call them together. So I did that, with someone who needed a dentist, you know, and then later on, they needed a foot doctor. Podiatrist, and then they were able to do it themselves because now they saw how we did it together, you know. So, it's a 6-month period with that, patient or client, and then they would be able to be in a better situation once they're done with the program.
And where's your office?
We are located at 45 Wadsworth Avenue, but we also have another location on 8 Clinton Place in the Bronx. You're welcome. Thank you.
Thank you.
Thank you. Should that also be as a health fair? Like, this information? I see that.
Did Christopher, did he say to put another note in the chat?
Yes, please.
Oh,
Yes, I would love for them to contact us to be part of the health fair.
oh, definitely. I was thinking that.
Even though I have it, just quickly give me your email address,
Mine is really.
Christopher.
Oh,
Alright, so I can give it to both of them.
awesome.
And then
It's,
two, right?
I'm gonna put it in the chat.
Okay, if you can. Did you get some of these minutes and put them in this one, drop it in the chat? Oh, okay, I know you're not.
I just put it in the chat.
There it is, C. Johnson.
Okay.
Good for the person.
Alright. Next, moving right along, next we have Dr.
Dr.
Torres.
Torres, and
Hi, so,
Edwin is a high achiever here, and he really works hard, so I wanna make sure he gets his props. He's so tied into medicine. And I didn't get a chance to make the corrections, on his, credits. I'll do that when I send out the revised. I was just really running today and yesterday and just couldn't get out a revised agenda. But anyway, he's done the Master's of Public Health, his MBA recently, as we all know, or most of us know, and doctorate as a nurse practitioner. So you might correct anything, but I'll definitely send it out to this committee so that we know, we know who we have working with us, so
And he said that.
the biggest title, yeah.
Okay, so we wanted Edwin to talk about what true accountability from the city of New York can mean for our district. So I want everybody to listen up and give input. I think this is gonna be really important for us this year. Okay, Dr. Torres.
Thank you, Guida, and to the whole, committee. Thank you all, and I mean, I love to come to this committee. This is like home for me because a lot happens here, and without health and environment, our health will be adversely affected. As we can see, when we're not proactive, we can see that it can have deadly consequences, literally. But I'll start with a lighter note. I think that we had an issue some time ago on 145th in San Nicolas. And this was an issue for many, many years where you had vehicles that were parked all over the place that created congestion. Folks there were complaining. And back then, like we and I were sat down and we're like, what can we do to fix this? And one can look at it from a traffic perspective, but the other way that you can look at it is from the environmental pollution health perspective. When cars are idling because of traffic, this creates, a health hazard for residents. And we wrote a reso, from that perspective and the impact that it had, that can potentially have on the community and those who were living there. Well, because of that, and thanks to the chair of the community board, Victor, who stayed on top of the agencies that were involved with this. Now you can go on 145th and San Nicolas, and it looks much better than before. And the good thing about Google Maps is that you can go back and see, the different time lapses. And I would encourage you to go just go back, look what it looked like in 2012, and then how it looks now. But with that, there's a lot of work that we have to do. If you look at this committee, there has been 30 plus reso that have come out. But resos are only good as the enforcement that we put into, our electeds, the agencies, and earlier, we were not trying to get at Pauline, but she's a representative from DOH. And I think that when people come here and they represent an organization, right, this is about the organization, not about you, right? And a lot of times we see that in the community, some of the agencies, they would try to get folks that are from the community who have some type of relationship in the community in hopes that, when they come to us, we might be just, a little, softer on them, right? But whenever somebody comes here from any agency, we have to remember that they're coming here representing the agency, not themselves. And we should hold them accountable. Great question by Cameron saying, look, why are all these outbreaks just happening in communities of color, in poor communities? Other places, they also have cooling towers. And, I spoke to the chair and he said, will this happen in NYU, right? Will this happen around NYU? Will this happen in NYU Hospital? Big question. Maybe it would, maybe it would not. But I think that for all of us, we have to just continue to push the city. And one of the things that I have sort of, and I'm going to keep bringing this to the community board is that we have a lot of trucks in the community, and the folks from WEAC, they know this way better than I. And that is that we have trucks that are parked in our community overnight. And according to DOT, these trucks, they should not be parked, in the community. They need to be at a truck depot. Why is that important? Why would somebody care about trucks and school buses that are laying around? Well, guess what? When you wake up in the morning, these trucks, they get turned on and they idle. And for some of you, if you remember, on 145th, we were complaining because there was a truck depot that was started there. Well, I call this a deconstructed truck depot, because right now, when you get out of CB9, you're going to see school buses. School is not in session right now. Guess what? Those companies are leaving those buses in our community. In the morning, they get warmed up, and all that pollution is going to come to our lungs. We have higher rate of asthma, higher rate of cardiovascular disease, higher rate of cancers. And this is not by coincidence. This is by design. And it's up to us to hold these agencies accountable. We have a reso on this. Where is it? And I think that, in that light, everybody comes with a passion, and we want you to, keep that fire going, because you are speaking for the voiceless. Where many people right now in the community who do not have, the political capital that we all have, because we're all here. But this is where advocacy come in. And, it is up to us to hold these agencies accountable, and continue to push them, because it is, in their hopes that we would just, overlook them. And with that, it is our health, our family members, our neighbors. And I think that we all deserve better. Just because we live in certain communities doesn't mean that we should have lesser of anything. I think it's just that we have to continue to hold these folks accountable. And I'm not going to keep going because it's a little late. And I'm always here if anybody needs any help.
Thank you. Oh,
Thank you.
Well, thank you, Dr. Torres.
Thank you, guys.
Any questions or comments related to just the issue of accountability?
And
what?
I think this Legionnaires thing gives us an opportunity to put the pedal to the metal, because I mean, it's something that's very current, and we still have questions and concerns. And even though, we know lawsuits are happening, it's clearly something that is preventive. And we really should push to have something mandated so that we can perhaps prevent it from happening again. I mean, prevention is the way to go. And I think that feeds into the accountability issue for sure.
Absolutely.
Pushing and to ask questions and to follow up. I know Senator Cordell Clare was writing some type of legislation to, I think, do something mandatory as it relates to the cleaning of the cooling towers. I think that's the start. I don't know if that's enough, but
now, because at the time that she mentioned it,
yeah,
she didn't know that the city, and all those buildings, so those kind of what is written now. If there's a way, have you gotten anything in the pipeline related to sort of?
We Act and Upper Manhattan Tenants Union had a forum here. Had a forum last week where we brought together community members. We gave them updates on sort of the Legionella situation, and then we sort of together formulated like what would our framework for like legislation that was actually responsive to this crisis look like. Honestly, I think there were a couple of good ideas that came out of this meeting that I think we're going to be trying to pull together into some legislation that we're going to be pitching to, Senator Clear and some other council members to see if we can actually implement something that is a little bit more stringent than the policies that are currently on. So look out for that, and once we have that proposal or that agenda, then we'll definitely be looking out for community support to get that passed. Yeah, but I think that's.
But I would say that we have a lot of resos that were already done. Look at them. You know, we don't, you know, a lot of the new ones with the engineers, sure, we got to get answers for this. But the ones that are already there, accountability is for us to say, hey, why are you not following up on this? Right? We already passed a reso on this. The community board passed a reso on this. We need answers here. And if you look at, I have spoken to some community members in our community who will tell you, I never smoke, I live a healthy lifestyle, and they will tell you, and I developed lung cancer. What happened to me? Well, many reasons as to why that happens, but one that I can tell you that is very well documented in the literature is that, environmental exposure and certain risk factor increases the risk of certain diseases. So I think that, we have to make sure that some of these agencies, they're held accountable. This issue about the food truck that people brought up to me, I say, okay, I'll bring it up to the community board, because we have to continue to bring it back to them and say, hey, what are you doing here?
That's exactly right. And we're gonna wrap up now, but let me just say, well, Monique may have had something, but let me just say, as Edward referenced, we have 31 resos. Several of them may deal with similar topics, but what we can, a similar issue. And what I think we might be able to do, Cameron, and with the committee, is if I divide them up or group them, and let's see what, who wants to take on what, and we all have something we can do that, gives us some, suggestions about further accountability. How's that sound?
We need to follow up to see where they are.
Right, we could discuss it in committee, okay, find out first where the city is, has this, what we suggested, has it happened, it might entail telephoning, downtown, Bay City Council member to see what has happened, has a bill come up related to this, has some legislation come up? And then, if not, then we can perhaps trace it back to, what about our city council member? Can they help more? What do they feel about it? Or if they don't feel good about it, what if the community is overwhelmingly behind it? So there are a lot of things to deal with, but where they shouldn't take it personally, but maybe take another look at the community's interest and see where they should go with it. So there could be a number of suggestions that come from you once you get these groupings. Let's start with that. So I'll try to have something, I will have something put together by the October meeting, if not before. All right.
New business really quick. I didn't bring it, but I know that Community Board 9 was looking to try to bring on a fellow. The city of New York, or the City Fund of New York, funds a program to bring in, I guess, a graduate student from some of the various schools that can do a stint for, I guess, the academic year. So CB9 was thinking of bringing on a fellow who can maybe help out and support the housing committee, because all the committees do a lot of work, but housing was one area we thought we could bring someone on board. A proposal has to be submitted, and one of the things that came up was looking at supported housing. And then I said, why don't we try to add a health component to it somehow? The thought was, people who have stable housing are better able to be productive in the community, period.
And less likely to
Right, so,
petty or.
right, so I know something has to be submitted by September 19th, and I didn't bring anything, because I didn't bring anything to share, but I could certainly send it to the chairs, and maybe there's an opportunity. I know housing is working on something, so maybe we can add a component to that just to strengthen it. That's why I'm bringing it.
Supportive housing basically deals with mentally ill, oftentimes there may be substance abuse or whatever, it's still mentally, there's some mental.
Right.
So yeah, maybe, because mental health has been our thing for the last 2-3 years, and we were talking about continuing it. Okay.
That's why I brought it up, because I know. Yeah, so I'll share the information with you guys, because I got it, and maybe we can see how we can add that whatever's being drafted.
You're not saying that we would have a fellow for this committee.
It wouldn't be for, well, there's an opportunity to submit two proposals. I think right now the goal was to bring on a fellow to perhaps work in housing, but maybe they can cross pollinate. We can see if it's something substantial to offer them.
Linda, just as some little not a whole lot background, but
Thank you.
generally, housing has been a major concern in our community. But it's been a major concern primarily because we tend in our district to get a lot of housing or requests for housing from mentally ill substance abusers. Sometimes they're drug users, outright. And we had neighbors who fought against methadone clinic, and it's always around, even 1727 Amsterdam that was mentioned before. You have, of course, Illinois, which just has a long history of working very diligently with mental substance abusers. But at the same time, we have so many in our community, and they're getting a little, I guess fed up would be a way, not in a hostile way, because we're not anti that. It's just that why can't they find something, other neighborhoods to spread this out because we feel saturated. So that's what's been happening. But then at the same time, we have to be very careful because many of them come from our neighborhoods. So that's the dilemma. So that's why I can kind of see this component of supportive housing, because that entails some psychologists or psychiatrists counseling going on with it. So how do we work with that?
If they're,
What's the opposition?
if the other neighborhoods aren't gonna support it, like, if not them, I guess us, like.
Well, Gavin came up with a nice, I thought it was a great idea.
You think maybe?
Yeah, after he.
But that,
yeah.
I think that's a longer conversation.
yeah. So, at any rate, that's just some backdrop. So we may not have to find something else. I think it's probably something that you have dealt with it to try to do something on a broader scale. We can discuss. Oh, I'll send out if Monique sends something to Cameron and I, we can work on drafting something, get it out to the committee for input real quick. Shouldn't be super long, right? Just so we can submit it to see how the funding and get it in for the right time.
Question, will the focus be to build more supportive housing? Is that the plan?
No, I think they just.
Well, I know we're looking at the issue of housing, and I haven't touched base with the chairs for housing yet to see what they have in mind, but I know it's something that was brought up, and I know they're working on something as well.
I happen to think it works. I tend to think supportive housing works.
Yeah,
And it does help, I'm a supporter of it, so I can.
right. Yeah, I don't think there is,
But I know there's a concern about.
I don't think that people aren't supportive of it in the community. I think the concern is the oversaturation.
Yes.
Yeah, so,
Yeah, I think that there's less supportive housing being built here in Manhattan than in Brooklyn and the Bronx.
Yeah.
I mean, that's where the majority of the supportive housing. Brooklyn right now is supportive housing.
oh, is it?
I mean, that's where the land is. That's where the.
More space, got it.
Right.
Okay, I know we have to wrap up because
Yeah.
Ashley has
If you
to.
wanna send,
I know,
send whatever you got.
I will, I will.
Send it,
I'll send it to both of you guys.
yeah.
Intern sounds great.
Yeah, so.
If it's handled, a lot depends on the organization and their handle.
All right, if there
So we-
are,
Is there, motion to adjourn?
So moved.
Okay, so moved by Monique and
Monica could move it, just I've been doing it all night.
and then,
Second, and then,
Janera.
I don't know what that means.
All right, thanks to everybody.
It's all good. Good night, everyone.
Thank you. Thank you.
It's 8:37, by the way, so it's 8:30.
That's not bad.
We started maybe 7 minutes later, but and then also we had a long session, but it was.
It was important.
necessary, it was important.
Because there were questions to be answered, so.
And,
Have a good night, everybody.
Good night.
I'm gonna yoga tomorrow.
You got the information from.
It's an experience.
And you're
for the anybody else send stuff?
education.
You guys. Oh, yeah, well, I'm not gonna be able to keep up with you. Should I go up? You know?
I can eventually, you will say, make sure after you work.
Are you involved in
That's really sure to remember what I'm just saying.
What was your name?
Liz, and that's my friend.
Cameron.
I'm a support.
Obviously the new member, and I don't know, if I had to, that's the teacher.
I work there. They don't build that much.
Yeah,
They
so-
have a lot in Manhattan. Listen.
Just.
You gotta go with the methods, you gotta go with.
I agree, and I feel like maybe.
I think the goal is-
Fellow turn into the big thing.
We need to get it out, let people know.
So I'm, just finished up with fellowship, reacting, I'm returning to medical school.
Yeah, because I think, last year.
Right, so what kind of stuff are you here?
Probably. Public health.
Yeah, mainly the new member.
That's needed, I don't.
Where-
Very, very good.
Oh, it's not, okay, let's break this down, and then put it away. So we can do that.
How do we get access to the AI?
Okay, so we're gonna save it, and it should go to the cloud. So we're gonna stop recording. Well, is this stop? Yes, stop.
Oh, yeah.
Yes, you will receive an email when the cloud recording is ready.
Gotcha.